Hi, my name is Ernest House Jr. I'm the Executive Director for the Colorado Commission of Indian Affairs in the Office of Lieutenant Governor, and I've had the honor of working here for the last 9 years under 3 different administrations. My family originally, my great-grandfather was the last traditional chief of the Ute Mountain Ute Tribe, Chief Jack House, who I'm honored, my family is honored to have as a stained glass picture here at the state capitol in the old Supreme Court chambers. And my father, Ernest House Sr., served as the longest serving tribal leader for the Ute Mountain Ute Tribe, serving over 30 years as an elected official for the tribe. The Colorado Commission of Indian Affairs is a state agency that serves as the official liaison between the state of Colorado, our state agencies, and our 2 Ute tribes, the Ute Mountain Ute Tribe and the Southern Indian Tribe. The Colorado Commission of Indian Affairs has been around for 38 years, and since that time we've actually expanded our outreach to include the historic tribes of Colorado, which are around 46, and also the off-reservation American Indian population, which is over 60,000 throughout the state of Colorado, represented in all 64 counties. Health concerns are high among American Indian populations due to various issues, due to certain communities that are on food deserts, the lack of healthier eating options and opportunities and programming on rural reservation communities, but then also for urban Indian and general American Indian populations, higher obesity rates, higher deaths around cardiovascular disease, and life expectancy rates, like in my tribal community, of around 50 years of age. All these compound to ways that we need to better work together, better programming, better programs that are not only initiated in tribal communities but work in concert with our state agencies. Well, the first thing is to contact the Office of Health Equity, as they are the liaison between the Colorado Commission of Indian Affairs and the Colorado Department of Public Health and Environment. They'll be able to provide you the right contact and information on the next steps. I usually tell people the biggest thing to do, the 3 points, is listen, listen, listen. And what I mean by that is when you go to these tribal communities, when you meet with these tribal representatives, you're there to really listen to their concerns. You're ready to listen to the history, the culture. Everything is so intertwined. Tribal history, tribal language, tribal culture, no matter which tribe you're dealing with, all 567 federally recognized tribes throughout the United States have their own history, have their own culture, and they want you to know about that. And so I think the biggest thing we can do is to come and to approach and to understand what the tribal community is going through before we try to come up with any kind of solutions. The worst thing we can do is say that we're from the government and we're here to help. I get this question all the time on whether you use American Indian, Native American, or Indian in general. And tribes have let us know that they prefer using tribal specific names. So if we know we're working with the Ute Mountain Ute Tribe, we can reference as the Ute Mountain Ute Tribe or Southern Ute Tribe and so on and so forth. For overall reports, programs, we usually use the term American Indian, Alaska Native. That coincides more with a lot of the language that the federal governments use and has been approved by the tribes. So one of the biggest differences that we see is the amount of time management with versus on the reservation and off. So if you're going to a tribal community, we have a meeting and there's a meeting scheduled, and sometimes it may go longer. Within the American Indian community, sometimes we refer to it as that Indian time. We're going to get there, but there's other things and circumstances that perhaps have pushed that back. And so the biggest thing I ask people to do is remove their watch, or just be cognizant that time management is very different on the reservation in some of these communities than off. Well, you can definitely go to the Office of Health Equity website, or you can go to the Colorado Commission of Indian Affairs website, which is at colorado.gov/CCIA. You'll see all of our resources, our Tribal Consultation Guide, which lists an Indian Education 101 in there, but then also some of the things that we're working on outside of your state agencies, community events, other partnership activities, our Twitter account and Facebook promotions that we also utilize and be a resource for other American Indian organizations throughout the state. So I just would like to thank the staff, the leadership at the Colorado Department of Public Health and Environment for the interest in the reaching out to the American Indian population. On behalf of the Colorado Commission of Indian Affairs, the tribes, we really appreciate the opportunity to work with your agency, and just encourage you to reach out if you have any question at all around American Indian history or culture. And our Colorado history with American Indians has been very checkered throughout our state's history, and through this process we've been able to encourage a better partnership, better communication, and better lifestyles and healthier living for all of our citizens throughout the whole state. And so again, Togoyak, thank you on behalf of the Commission, and we look forward to working with you.